Do you know what metastatic cancer is and how it affects the body? Metastatic cancer is a complex condition that occurs when cancer cells break free from the original tumor and travel to other parts of the body through the bloodstream or lymph system. This process, known as metastasis, can occur with various types of cancer, making it a widespread concern in oncology. It's important to note that metastatic cancer is not curable. This might sound alarming, but don't lose heart. While a cure might not be possible, there are numerous treatment options available that can manage symptoms, slow down the progression of the disease, and significantly improve the quality of life of those affected. Whether it's the lungs, liver, bones, or brain, metastatic cancer can reach numerous parts of the body, each with its own unique set of challenges. But remember, knowledge is power. Understanding metastatic cancer is the first step in managing its impact. Ever wondered how metastatic cancer spreads in the body? Well, the journey of metastatic cancer, also known as stage 4 cancer, begins at the original tumor site. It's a process that's as intricate as it is unfortunate. You see, cancer cells, unlike normal cells, have the ability to disconnect from the original tumor and migrate to other parts of the body. How do these rogue cells travel, you ask? They use our body's very own transport systems, the bloodstream and the lymphatic system. Yes, it's a bit like a hitchhiker using our highways to get from one place to another. Now let's imagine the bloodstream as a network of roads. Cancer cells enter these roads through a process called intravasation, and once they are in the bloodstream, they move along with the flow of blood. Similarly, they can enter the lymphatic system, which is like another set of highways in our body. These cells then utilize a process known as extravasation to exit these highways at different locations. Once they've reached a new location, these cells start to grow and form new tumors. This is called colonization, and it's the final step in the metastatic process. Now, these cancer cells don't just settle anywhere. They have some preferred destinations, much like how we humans prefer some cities over others. The lungs, liver, bones, and brain are common sites where these metastatic cancer cells like to set up camp. Each of these locations presents a different environment, and the cancer cells adapt accordingly, leading to different types of symptoms. For instance, if the cancer cells settle in the lungs, they might cause coughing and chest pain. If they choose the bones, they might cause bone pain. In the liver, they could lead to abdominal symptoms, and if they find their way to the brain, they could cause neurological symptoms. So you see, understanding the journey of these cancer cells gives us insight into why the symptoms of metastatic cancer can vary so widely. It's not a pleasant journey to envision, but it's a crucial part of understanding this complex disease. Knowing how metastatic cancer spreads can help you comprehend why its symptoms vary. What symptoms might you experience with metastatic cancer? Metastatic cancer, as we know, is when cancer cells spread from the original tumor site to other parts of the body. When this happens, the symptoms that arise can vary greatly, and they largely depend on where the cancer has spread, or in medical terms, where the metastasis has occurred. Now, let's say the cancer cells have found their way to the bones. In such cases, bone pain is a common symptom. This pain often intensifies at night and may even exacerbate with movement. When cancer cells migrate to the brain, neurological symptoms might surface. These could range from headaches and seizures to changes in vision or speech. Some people may experience balance issues or find it challenging to perform routine tasks. If the lungs become a site of metastasis, symptoms often include persistent coughing and shortness of breath. Some individuals may also experience chest pain or discomfort. When cancer spreads to the liver, it frequently presents as abdominal pain or discomfort. Other symptoms can include loss of appetite, unexplained weight loss, or a noticeable yellowing of the skin and eyes, a condition known as jaundice. It's important to note that these symptoms don't necessarily mean you have metastatic cancer. They can be caused by a variety of other health issues. However, if you're experiencing any of these symptoms, particularly if you have a history of cancer, it's crucial to consult with your healthcare provider. While these symptoms can be concerning, remember that early detection and management can make a significant difference in the course of treatment. So, don't hesitate to seek medical attention if you're experiencing any unusual or persistent symptoms. Recognizing these symptoms promptly can aid in managing metastatic cancer effectively. How do medical professionals manage and treat metastatic cancer? Well, the treatment of metastatic cancer primarily depends on where the cancer originated. This is because the cells in a metastatic tumor resemble those in the original cancer. Now, the most common treatment options include surgery, chemotherapy, radiation therapy, or targeted therapy. Surgery might be performed to remove as much of the tumor as possible. This can help alleviate symptoms and prevent further spread. Chemotherapy uses drugs to kill cancer cells. It can be systemic, affecting the whole body, or regional, targeting specific areas. It's often used when cancer has spread widely throughout the body. Radiation therapy, on the other hand, uses high-energy particles or waves to destroy or damage cancer cells. It can be beneficial for treating cancer that has spread to the bones or brain. Lastly, targeted therapy works by targeting the specific genes, proteins, or the tissue environment that contributes to cancer growth and survival. These therapies can be quite effective, especially when the cancer's genetic makeup is known. Remember, the goal of these treatments is not only to prolong life, but also to improve its quality by managing symptoms and side effects. Despite its challenges, metastatic cancer can be managed with appropriate treatment strategies. How can one cope with a metastatic cancer diagnosis? It's a question that weighs heavy on the minds of many. As we navigate this journey, it's crucial to remember that you're not alone. Support from healthcare providers, counselors, and support groups is often a lifeline. They offer a safe space to express fears, frustrations, and hopes, providing guidance and encouragement when it's needed the most. Healthcare providers are more than just dispensers of medical advice. They're there to help manage your symptoms, offer reassurances, and guide you through the labyrinth of treatment options. Counselors, on the other hand, can provide emotional and psychological support, helping to manage the stress and anxiety that often accompanies a diagnosis of metastatic cancer. Support groups, both in person and online, are invaluable. They offer a sense of community, a place where you can connect with others who truly understand what you're going through. They provide practical advice, emotional support, and a reassurance that you're not alone in this journey. The road to coping with a metastatic cancer diagnosis can be tough, but remember, it's not a road you have to walk alone. There are many people, groups, and organizations ready to help, to listen, and to stand with you. Remember, support is always available when dealing with metastatic cancer.